It's a 2-year program with 52.5 credit hours. Students take about 23 core courses, and these would be sort of standard courses you would expect in any MBA program. So things like economics, accounting, finance, marketing, management, and so on. And some additional courses that are specific to the healthcare industry, like healthcare policy, for example. Then students take 12 different elective courses, and they have to choose from things like risk and compliance management in the healthcare industry or electronic medical records. A good proportion of every one of our courses are taught asynchronously. That means that the student and the faculty member don't have to be in the same room for the student to actually go through a learning process. But there is, and so in that way, that particular period of time, students can then learn on their own. But then there are moments in every course where synchronous learning occurs, where the student and the faculty member have to be in the same place at the same time. So it is convenient. Students get to learn on their own, but there are certain times of the day, usually in the evenings or weekends, when it's more convenient for working students to be online, where they actually get that one-on-one experience, that very rich experience of that sort of synchronous learning moment with the faculty member. You need sort of strength on almost two sides of one coin. You need the strong industry expertise in terms of healthcare administration, but you also need, I think, good, strong fundamental business skills. And at George Washington University, through our program, you have the ability to learn from faculty from a very strong school of business, as well as a very strong school of public health. I think that's what really makes the program quite rich, is that you have faculty members from both schools really working together to bring this program to life. The student needs to be able to kind of look at their life and really figure out, where are those learning hours going to come from. 2 years sounds like a long time, but it goes by very quick to complete the program. And I think a student, to be a good fit for the program, needs to really be able to have that time in the day where good, meaningful, impactful learning can take place. For some people, that's late at night. For some people, that's weekends. For some people, that's early morning. But I think a good online student has that very hard conversation with themselves, looking at their schedule in a very detailed way, and really has to carve out the time, often with great opportunity costs, to say, this is when I learn best, and this is when I can learn. And then really keeping the discipline to making that learning time the time where they actually engage with their coursework. That's what I think is really essential for success in any online program. Well, I think people that are going through careers in this particular industry have lots of different kinds of master's degrees to choose from. And one focused on business may not always necessarily be the best fit. So I think an individual has to ask themselves, what's the end game? What are they trying to accomplish? And to what extent is, in that career progression, better, deeper knowledge of efficient, effective business skills going to help them achieve those goals in their particular industry? And if the answer is that's going to be a crucial or large part for a need for advancement, then this type of degree, I think, is really the best fit. Because again, the degree is designed to give you those good, strong, basic business fundamentals, but applied in a certain particular industry. We've really been trying to bring more opportunities for students to really experience healthcare in a global setting in a very real way. So outside the online learning classroom, we're also providing opportunities for students to do a study abroad, short term, if they're able to and are willing. So in our elective space, for example, exclusively taught through our Healthcare MBA program, students can actually do a comparative healthcare policy course taught by one of our lead faculty, Anna Helm. And students in that course actually make a trip to Sweden and spend their time in their course comparing Sweden's healthcare system with the U.S., which I think is a very interesting model. It also gives students a chance to meet on a trip face-to-face many of their colleagues and friends that they've met in the online healthcare policy program. I think that also we've been offering new courses that are open to students across all 5 of our MBA programs. And many of our healthcare students opt to take those courses as well. I, for example, just got back from Ethiopia, where I took a group of students, some of whom were in our online healthcare MBA program, to Ethiopia to learn about the role that diasporans, migrants who return back to Ethiopia, and the role that they're playing in that economy and society. And a large portion of that course was understanding the role that Ethiopian doctors and nurses are playing by going back to Ethiopia and bringing new innovations, new techniques, new processes, and starting new healthcare-related businesses in Ethiopia.